Good morning, members. We are happy to start this webinar. I'll just request that we do pray so that we can start our webinar. Let's bow down our heads and pray. Gracious Heavenly Father, we thank you this morning for your grace that you've given us to enable us, Lord, meet once again and discuss this important topic before us, especially knowing that we are living in challenging times. We pray for your grace and for your guidance. In Jesus' name, we do pray and believe.
Amen.
Now, members, I want to ask our Executive Director, Madam Jacqueline Mugo, to give her opening remarks. Madam Jacqueline Mugo is the Executive Director and CEO of the Federation of Kenya Employers. She's also the Secretary General of Business Africa Employers Confederation, which is the employers organization for the continent of Africa. And she's the titular member of the governing body of the International Labour Organization. As you all know, the International Labour Organization sets standards for the labor sector in the whole world. She's also the Vice President for the International Organization of Employers, IOE, for Africa. And she's also the founding chairperson and a member of the Executive Committee of the East African Employers Organization, which is our employers organization for the region. She's a board member for the NSSF, HELP, NEA, and the National Labour Board, and an advocate of the High Court of Kenya, a very seasoned person in the labor movement who has shaped a lot the labor organization. Madam Jacqueline Mugo, welcome to give the opening statement.
Thank you very much, Stephen, for your kind introduction. Good morning, members. Good morning, friends and colleagues. It is our pleasure to host you during this third webinar that we are conducting this year. We have been holding webinars since the pandemic descended on us last year. And for this particular year, this is our third one. In the first two webinars, we were discussing the ever-changing business and regulatory environment in Kenya. And we had a very open discussion on this topic. At that point, the Business Law Amendment Act 2020, the Housing Levy, the Employment Act, and the Unified Payroll System were hot issues that were under discussion. And we are very happy that given your inputs and the efforts that FKE has made, that a lot of the changes that were proposed have been withheld by Parliament. The second topic we looked at was demystifying the health laws and NHIF Amendment Bill 2021. This was an open discussion, and we were looking at the proposed amendments to this act, which really would have required employers to match employees' contributions in terms of supporting the NHIF. We've had very robust engagements with Parliament and various policy makers. And as you are aware, members, this proposal has been put on hold, but we will continue to engage. We are very happy with your support and with your inputs, and also appreciate the action taken by our legislators not to effect these changes at a time when business is suffering. Today, we are discussing a very topical issue. It's been a very hot issue. A lot of members have been asking us, as you've seen what's unfolded in the public sector, what is the employer's role when it comes to vaccination? Can we require employees to be vaccinated? A lot of politics around this topic. So we're looking at the politics of vaccination at the workplace. As you're aware, members, COVID-19 has continued to have adverse effects on enterprises, on the global economies, and many countries have embraced COVID-19 vaccination as a specific measure aimed at building immunity and reducing the risk of severe disease and mortality among populations. And subsequently, these economies are also facilitating reopening of businesses. As of now, in Kenya, barely 3% of the population, about 2.97 of the adult population has been vaccinated. In fact, if you watched the news yesterday, even those who've been vaccinated the first time with the AstraZeneca have not gone for the second vaccination. So there are various efforts that the government is undertaking towards promoting the uptake of the vaccine, and these are ongoing measures. the target that we have been told is to have 10 million Kenyans vaccinated by the end of this year. So the question that many Kenyans have been asking, and employers as well, and workers, is, should everyone be vaccinated? What about the very elderly? Do we have enough doses? Should the vaccine be mandatory? Must everyone at the workplace be vaccinated? Can an employer require employees to be vaccinated as a precondition to work? These are the questions informing our topic today. And we know that this matter is under litigation. We're not going to go into the pros and cons of the case, but I think there are a lot of policy issues, there are a lot of decisions and actions that require employers, the government, and employees to work together to be able to meet this target of 10 million. And certainly for the workplace, it's a major conversation. Our aim today is really to share information and also to listen to industry people, what have they been doing on the ground, to listen to policymakers, and to listen to people from our ministry to tell us what is happening. We want, at the end, to appreciate our role as employers and how we can work together with other stakeholders to make it possible for Kenyans to address this issue of vaccination and make informed decisions. We're very proud to have a very eminent and knowledgeable panel to lead us in this conversation. We really do appreciate the time that our panelists have taken to prepare and to avail themselves for this webinar this morning. With us, we are very proud to have Dr. Mercy Mwangangi, who is the Chief Administrative Secretary in the Ministry of Health in this country. She, I think, is now a familiar face in all households. She is a doctor by profession. Previously, she was the head of health, financing, economics at the Ministry of Health in Kenya, and also secretary in the Task Force on Universal Health Coverage. Dr. Mwangangi holds a Bachelor of Medicine and a Bachelor of Surgery from the University of Nairobi, and a master's degree in health economics and policy from the University of Adelaide in Australia. A very warm welcome to you, Dr. and thank you so much for taking time to be with us this morning. Our other panelist is Engineer Peter Toom, who is the Principal Secretary in the State Department for Labor in the Ministry of Labor and Social Protection since March 2019. Prior to his current position, he was the Principal Secretary in the Ministry of Health. Engineer Toom has a wealth of experience, having previously served as the Chief Executive Officer of the Kenya Medical College, KMTC. He holds a master's degree in energy management from the University of Nairobi, a Bachelor of Industrial Technology from Egerton University, and a postgraduate diploma in medical electronics from the University of London. A very warm welcome to you. We also have with us one of the strongest members of the Federation for many years, and we are very proud to have with us this morning Mr. Wasike, C. Wasike, who is the Deputy National Chairman, Kenya Association of Hotel Keepers and Caterers, a position he has held for the last 10 years. Mr. Wasike is also the Group Operations Manager of Heritage Hotels in this country. He has previously worked in Sarova Hotels and the Intercontinental Hotel. He is a fellow of the Institute of Hospitality in the United Kingdom, a member of both Tourism Professionals of Kenya and the Association of Hotel Practitioners of Kenya. Mr. Wasike is a graduate of the Kenya Utalii College, and he holds an MBA from the University of Free State in South Africa. A very warm welcome to you, Mr. Wasike. Also with us is Mr. Sean Miller, who comes to us from one of our member organizations. He is the General Manager, Dua Estate Limited and Rare Vipingo Plantations, one of the strongest and oldest members of the Federation of Kenya Employers. I will also be participating in the panel. Thank you all very much, and let me hand over to Stephen to take us through the panel discussions.
Thank you, Madam Executive Director. You have highlighted that this is a very important issue we are discussing, the politics of vaccination at the workplace. let's start with setting the scene and see the current state of affairs. And I'll start with you, Executive Director. If you can just highlight to us what is the current state of enterprise today. Now we are almost 2 years from the onset of COVID-19.
Thank you, Stephen. I think we all know that COVID-19 descended on us in the first quarter of last year in March. It remains a global public health crisis with massive economic disruptions, social impacts, and labor market shocks. The pandemic has resulted in a global economic slowdown as countries were faced with supply chain disruptions, rising cases of unemployment, and reduced consumer purchasing power. Because of the impact of the pandemic, the world had to take very stringent measures to contain the spread of the virus. This has resulted in various levels to workplace closures. Workplaces have opened, but not fully. It has led to work stoppages, reduced working hours globally, reduced productivity, and also the continued disruptions in the supply chains. This has consequently led to a decline in the earnings and profitability of enterprises. In Kenya, the figures that we have, I think, are actually lower than the real figures. As at last year, 1.7 million jobs had been lost in the formal sector. For the informal, the situation is quite grave. In a survey which the Federation conducted mid last year, we saw that up to 5 million jobs were lost in the informal economy arising from the pandemic. This survey indicated that most enterprises are struggling to remain afloat, even today. They are struggling to manage direct costs and also to remain relevant and afloat. They have also had to incur heavier costs, including the costs of maintaining the high standards of safety, health, and wellness required to deal with the pandemic. We've all seen the different measures that the ministry has so well articulated and encouraged us to put in place and to continue doing: washing hands, social distancing, and wearing of masks. All these require investments. So companies are struggling with that. They've also had to invest in technology to support employees to work from home, which continues up to today. During the last 1.5 years, since the confirmation of the first positive case here in Kenya, I must say that not all is doom and gloom. There is some element of improvement in the business environment because the economy has opened up to some extent. But the thing that is plaguing business is uncertainty. The future is unpredictable, so business cannot plan. It is difficult for businesses to operate in an environment where you can't plan. According to the statistics that we have, enterprises are still struggling. The purchasing power is low. So although there is increased private sector activity, which is supported by the measures that our government and the ministry have taken, we know that the business environment has not been eased. We are still operating under curfew and restricted working hours. So this, at the end of the day, has meant that business is not normal. And we are really looking forward to a time when we can reopen, but that is not the case as we speak now. Stephen.
Thank you, Executive Director. And you set for us the scene indicating the state of the enterprises. Now, we are talking about the pandemic, we are talking about COVID-19. Let's hear from the Chief Administrative Secretary, Dr. Mercy Mwangangi, what the current state of COVID-19 is and the vaccination in the country. Dr. welcome.
Thank you. Thank you, host, and thank you to the FK team for providing this platform for us to be able to share with you the politics of vaccination at the workplace. When we look at the current COVID-19 situation, in terms of the disease itself, I must say we're still on an amber to red alert zone as a country. We continue, particularly right now, during this so-called fourth wave, we're seeing admissions are still on the steady. We're still seeing needs for oxygen being required in different parts of the country. We're still seeing cases, particularly in rural Kenya, And so I would say as a country, we are on an amber alert zone. I know we've had discussions most recently, particularly in the last 2 weeks as a ministry. We have shared with you that yes, the fourth wave has gone beyond the point of inflection, where if you're looking at the curve, we were riding high on that curve, and now the curve is coming down. And yes, that is the case. We do expect to see reduced admissions as we continue on in the next 2 to 3 weeks. However, why I say we're still in an amber zone is because as a country, when we look at our vaccination statistics, we still need to do a lot to ensure that a large proportion of Kenyans are vaccinated. Taking a deep dive into vaccination, as at yesterday, we have about 2.8 million doses that have been administered. And these 2.8 million doses consist of both the first dose and second dose. And of course, primarily they consist of AstraZeneca, which was the first vaccine platform we had in the country. Today, we are very happy because we have about 3 platforms available. We have AstraZeneca, we have Moderna, and we have Johnson & Johnson. Those have come in within the last 2 weeks. And within the end of this month, we actually expect to have Pfizer coming in around the 24th of September. And also Sinopharm, which is from China. And so at the end of it all, our country will most likely have close to 5 to 6 vaccine platforms. When we look at the situation, where we are in terms of vaccination, I think the key driver of our rates of vaccination have been the number of supplies that we have available in the country. Right now, government has done tremendously well because by the end of this month, we actually anticipate between September and October to have close to almost 9 million doses circulating within the country. And so this means the constraints that we've previously had when it comes to supply chain issues have now been mitigated. And what we need to work on is vaccine hesitancy and to ensure that these doses get in. And I really do agree with Madam Mugo. She shared her presentation and talked about the uncertainty and what this uncertainty has led when it comes to disruptions in business. What we aim to do as government is through our vaccination program, we need to provide some elements of predictability. We have a target of vaccinating 10 million Kenyans by December. And if we can meet this target and perhaps even surpass it earlier than December, all indications show us that this would then, of course, lead to the reducing or the de-escalation of the current measures that we have in place, particularly the curfew measures and the various other restrictions that are there. And of course, if we can ensure that Kenya continues to maintain this steady stock of supplies, it means that even in the coming year, we would then, of course, be able to have a de-escalation of these containment measures, and of course, then assure that certainty and predictability is necessary for business. And so that is what is happening right now. We are seeing improved demand in terms of the uptake of vaccines, particularly with the new vaccines in town, Johnson & Johnson and Moderna. We're seeing a lot of demand from Kenyans, from industry players, from employers, employees, all organizations. We continue to maintain that we do have a priority list that we need to follow. Of course, those that we are targeting the most are those who are over 58 and who have comorbid conditions. But also, increasingly, we've expanded this to include essential workers. I saw in the Q&A, as I logged in today, I saw a question on whether the ministry is able to send teams to different organizations to provide vaccination services. Yes, indeed, this can happen. However, it would need to be a formal process where you write to the ministry through the office of the permanent principal secretary. And then we're able to then, using our criteria of evaluation, determine whether a team can come or whether yourselves can go to a health facility that is near you. And so what we're saying is right now we're in what we'd call the rapid results initiative phase of our vaccination campaign. We have changed our strategy. Previously, we were static. We were sitting in the health facilities. But right now, in the coming few weeks, you'll see a lot of outreach services. You'll see us in the different bus stations. You'll see us in churches, trying to ensure that Kenyans are able to get their vaccines. So in a nutshell, there's a lot we can discuss. When you say the current state of COVID, I could get into the details of treatment, oxygen availability, testing. However, this is just, a broad summary of where we are right now. Thank you, and over to you.
Thank you, Dr. And that is really, really informative, looking at the effort that the government is putting into place to ensure that the vaccination happens, and also providing different platforms so that then the citizens can have a choice on where to go, and even the employers. And now looking at this politics of vaccination, there is something that comes up. We know that there's been indication, and especially from government, and about the workplaces. And as you rightly said, part of the things you're looking at is the vaccination for the frontline workers, having a priority list and all that. Now, if you look at the mandatory vaccination, especially looking at the workplace, and we see the emerging issues, perhaps we'll be interested as the employers to see what the ministry is doing to ensure there is an improved uptake of the vaccines, increase the availability, especially of these vaccines at the workplaces for the different staff and even employers. And then in what we are doing, how are we comparing with other countries, especially if you look at the region and even globally, how are we comparing as Kenya when it comes to vaccination?
Thank you. All very important and pertinent questions. And I think I'll start with, what measures are we putting in place as a ministry? When we began our vaccination campaign, we essentially had just the AstraZeneca vaccine platform. And in terms of the facilities that were offering vaccination, I think we started at about 300 facilities across the country. What we've done since then is that we've continuously increased the number of facilities that are able to offer this vaccination. And our end goal target by December is to have close to 3,000 facilities in the country that are offering vaccination services for COVID-19. We do have a technical team that is looking at this to determine whether we can actually surpass this target of 3,000. In the country, we currently have about 10,000 facilities who usually offer the normal childhood vaccines, the ones that we call KEPI, the BCG and the DPT vaccines that our children usually get. And so as a country, we do have that capacity to really stretch out our vaccination facilities and to ensure that that's available. So one key strategy we're adopting is to ensure that the posts are available and that they're increased with a target of 3,000 by December. The second thing that we're doing is that we've really tried to engage and build the capacities of our healthcare workers. We started with a small team, and with each new vaccine that comes in, we're increasingly adding the number of healthcare workers who are able to vaccinate and who are also able to manage the chanjo system that you have in play. And so these two strategies of having workers who are doing it and of course having the IT system supporting them is a strategy that will definitely improve when it comes to us getting increased coverages for vaccines. The third, I think, important thing that we are doing, and particularly as employers, which would be useful, is we're really engaging with the different stakeholders in all the different spaces. We decided to revamp our communication stroke community engagement campaign when it came to the vaccine. And so what we're doing is focusing on those champions in the community who can actually drive numbers when it comes to demystifying misinformation for vaccine hesitancy and then providing the vaccines. And that's why I'm happy to be with you today, because if you are an employer and you have a large contingent of workers underneath you, it is possible for us in view of time and logistics to actually plan a vaccination drive within your facility and ensure that everyone in your facility is vaccinated. And so again, leveraging on your networks and your strengths, this is something that we intend to utilize all the different institutions. Another key thing I think that is quite important is what I discussed earlier in terms of our outreach approach. Like I said previously, we were static within facilities. Now we are going to churches, now we are going to bus stations, now we are setting up vaccination centers and in prison units to ensure that we really go to the people. And we are working with government administrative structures, such as the Ngao structure, to ensure that the chiefs are working with us to ensure that more and more people come forward for vaccination. We are also, of course, trying to deal with misinformation. That continues to be an issue. And we are particularly pleased because the church, through the Interreligious Council, which has been working with us, is actually supporting the vaccination drives and have come forward to say we can actually utilize their facilities. Remember, in Kenya, 40% of healthcare services are provided by religious facilities. And so that's a big network that we plan to leverage on and to utilize that resource to ensure more and more Kenyans get vaccinated. I think another key element would be to have a sense of, I say, political leadership and governance and championship when it comes to vaccination. And I must say, as government, one of the things that we really support is the move to have all civil servants vaccinated, and perhaps I would even say the directive to ensure that all civil servants are vaccinated. When we look at our data, when we look at the interactions, when we look at and discuss issues such as continuity of business, continuity of government business, it's becoming imperative that as government, we have to ensure that everyone working within the civil service structure is vaccinated. And so within different ministries, I'm pleased to inform you, we're having good numbers within the Ministry of Health, the Ministry of Foreign Affairs. Those are ministries who are doing very well in ensuring that their staff are vaccinated. We are also utilizing our healthcare workers as champions for vaccination. And, you know, COVID-19 is a new disease. The vaccination strategy campaign that we are running is also new. So we keep learning as we go. Most recently, we've come across information concerning vaccination and mothers, pregnant mothers. And I'm sure if you are reading the news, about 3 weeks ago, we had quite, a few mothers succumbing to the disease because they were not vaccinated. And so working with the different medical associations, we're trying to demystify some of these facts, calling on to mothers to come forward and vaccinate, noting that the benefits outweigh the risks. And so we have recognized our healthcare workers as key champions in terms of running this campaign. And very soon you'll also see our engagements with the unions and the healthcare workers being the front faces of this campaign as they engage with the community, and even amongst themselves demystifying some of the fears or misinformation that they may have. I hear you on the main topic of, and I'm coming to conclude my presentation, but I hear you when you talk about the politics of vaccination and whether there are any provisions in the law for this and whether it should be mandatory. I think if we can be pragmatic, one, of course, any intervention that is offered, particularly any medical intervention, requires to be voluntary for anybody who's getting it. And that's the baseline of any medical intervention. And I speak as a doctor, but also as a policy maker. But number two, it becomes then important to always have a view of the externalities. For example, many of you may know that one of the biggest gains we've had in this country is in our infant or in our childhood vaccines. The fact that we have children who are vaccinated against, BCG, TB, DPT, has actually earned Kenya a lot of, should I say, admiration, particularly when it comes to polio. And the idea is that when you vaccinate, vaccination becomes a public good. It doesn't only protect you, the person who is vaccinated, but it actually protects the community around you. And so in essence, there's what we call a positive externality in this space. And so what we see and what we stand for right now as government is that, yes, vaccination is voluntary, but they need to nudge and urge the citizens to come forward. And I think no one else would understand it better than FKE, where we need to have predictability when it comes to business. We need to have continuity. We need to start learning how to live in this new normal. And I can tell you, some countries, particularly those that we are benchmarking with, have been able to do this in various mechanisms. For example, in America, you can now not access restaurants, gyms, and different utility areas without showing your vaccination status. This is the same situation in South Korea, in Japan, same situation in Canada. We have buildings, institutions that will not admit you until you're able to demonstrate that you've been vaccinated. And if we can be pragmatic about it, this is essentially nudging people to ensure that they are vaccinated. And so I do say that right now, while we might not have a law, in place that says it is mandatory, should it be necessary? For example, if we were dealing with Ebola, the Ministry of Health, together with the Ministry of Interior, can always invoke the Public Health Act, and we can always therefore mandate certain measures that would then protect the public. And so really, as government, we do stand by the need to ensure that people are vaccinated. Those within the civil structure are vaccinated. Those outside of the civil structure are nudged or incentivized towards vaccination, because that is the only way we can get back to normal, and particularly for our economy, which has been greatly disrupted by this pandemic. Thank you, and over to you.
Thank you, CS. You've highlighted very important issues around the vaccination, and especially looking at the access, the availability of the vaccines, and trying to ensure that most of the population accesses these vaccines, and even how you interact and with the stakeholders, and also trying to ensure that the businesses and the government continue, and we are able to de-escalate the COVID-19 response measures that we have if we get more of the population vaccinated. And I liked what you said, that for the government is taking it as mandatory to get all the civil servants vaccinated, so that then we can have government continuity. And as businesses also, there is need for that business continuity, and we'll be coming back to you on that. But now, as we give you a break, I want to go to the Executive Director of the Federation of Kenya Employers, and I will want to understand from the FKE perspective, what measures is FKE advocating for to address COVID-19 pandemic and to deal with the effects of COVID-19 at the enterprises.
Thank you, Stephen. You know, first and foremost, if you look at it from a legal perspective, because employers want to do what is right in the eyes of the law, we are required as employers to provide safe workplaces. We are required to ensure that the employees who report to work have healthy conditions within which to work. So this safe workplace obligation has called upon employers to do that which is necessary to enhance health and safety, because it is what is required of them. And actually it makes business sense, because you need to have a healthy workforce to be able to deliver on your business objectives. So it makes sense to us. What has been emerging, therefore, is how to go about it, because we want employees to have shared responsibility when it comes to matters, health and safety. So FKE has been doing a lot of awareness raising. We've done webinars on this specific issue to help people understand the connection between health and safety, the performance of the enterprise, and the good of the employee himself. What we have needed is what Dr. Mongangi was talking about, is also support from a policy perspective to make it possible for this to happen, so that we can roll out the health and safety measures that the government has put in place with the support of the government and the workers and the unions. And that brings in the issue of vaccine availability, which has been addressed, and then acceptance by Kenyans. So it's very important to us that this rollout plan of the vaccination program works, so that we can all adapt to it. And specifically, we need to look at workers in the services sector, which have a very strong interface with customers and mixed with a lot of Kenyans. And other countries have really taken measures to protect the population. We have given the responsibility by and large to Kenyans to do that which is right. But we need a sustained push for the uptake on the COVID-19 vaccine. This is why we thought it was important to have this conversation, so that all eligible persons really can be willing to take up the vaccination, so that we can enhance that health and safety. We've talked a bit about the macroeconomic policy. We continue to advocate for the government to put in place sound macroeconomic policies, so that we have some stability, some predictability, and that also depends on us as business people in doing the right thing. We need really broad-based policies that spurs private sector investment, boost employment creation, or keeping people in jobs, because you know a lot of jobs have been lost, and that has a ripple effect on the economy and on the social structure of the country, on the mood of Kenyans. Because if people are stressed, they have no way of earning a living, it makes it very difficult to govern. So we've been pushing for prudent fiscal management policies, so that also we can control the public debt and avoid heavy taxation to enterprises. So every time there's a proposal of a new tax, we talk about it. And there have been many in this COVID time, very many new ideas of how to finance some good projects in the country, but the push for private sector to be more heavily taxed is something that we've engaged heavily on to be able to maintain that element of certainty, some element of certainty. Avoiding increasing the cost of doing business is very important to us because we want to see enterprise recovery, especially the SMEs, which I indicated earlier, have been very hard hit. We can't talk about this without looking at the political environment and the electioneering phase that we are increasingly entering into. FKE has advocated for soberness in engagement by the political class as they engage and push their agenda. We do want to have that done in an atmosphere that encourages social dialogue and contains rhetoric that may raise temperatures in the country, because a conducive business environment is dependent really on the mood in the country. And that mood is affected by the macroeconomic policies of the state there, but also by the political mood in the country. And that is increasingly getting hotter by the day. We have been working and will continue to work on engaging the political class in how to conduct this really just as business people, to be able to allow the country to do business and for as long as possible before the elections, which we expect to be in August next year. If we have a prolonged heated electioneering period, which we have been having, then it inhibits private sector investments. Any person looking at Kenya will wonder, so is the country going to implode? What's going to happen? How long will it take them to settle? That then brings some element of hesitancy to new investors, and we don't want to see that. So as the country heads towards the electioneering period or increases the electioneering, because we seem to be already in it, we would really want to urge all the players in the political scene to engage in a calm manner and also to think of the good of the country and continue to observe the Ministry of Health protocols, because we are increasingly concerned when we see large crowds of people, either in funerals or in a rally of some sort. A politician is on the roadside addressing them, and you don't see people wearing masks. You don't see them observing social distance, and that is a major concern to us. So the political leadership should really encourage their followers and the masses to observe this so that we don't erode some of the gains that we have made. Back to you, Stephen.
Thank you, Executive Director, and very important points you touched on, and especially looking at the understanding of the shared responsibility that we have when it comes to vaccination and even management of the pandemic, and looking at how we are trying to ensure that we support the government to roll out the plan and be able to get so many vaccinated, and also touched on the political developments in the country, looking at the political mood and calling upon the political class to be able to observe the protocols that are issued by the Ministry of Health so that we don't erode the gains that we already have, to encourage responsible behavior among the political group and even the followers, so that we don't get to a situation where our businesses cannot operate. Now, we want to hear some experiences from the industry, the people who are really affected, and to see what the impact of COVID-19 has had on their businesses and what they are doing to ensure that their staff are vaccinated and the challenges they have encountered. And so I want to ask to start with Mr. Sean Miller, who is the General Manager for Rare Vikingo Plantation, just to highlight to us what effect the impact of COVID has had on his business, and what he has done to ensure that the staff are vaccinated and the challenges that he has had so far. Mr. Miller, over to you. Perhaps Mr. Miller, you can unmute and then share your experience.
Sorry, can you hear me?
Yes, we can now.
Good, sorry, my connection's not very good. Just in order to give you a little bit of background of what we do, we're obviously in the agricultural industry. I'm at Dwar Estate, and we're basically 8,900 hectares, predominantly sisal and some horticulture. So we're also a very labor-intensive industry. We have 1,200 permanent staff and another 2,000 on contracts. So we're 3,200 people working for us. And obviously that means it's essential that we have a healthy workforce. Without that, we are unable to do business. So obviously the COVID pandemic has caused some issues for us and has meant that we've had to change the way we work. Just to give you an understanding, in terms of vaccinations, we currently, as of today, sit on only 3% vaccinated. And really, that's two main issues. Obviously, supply is a problem, but the bigger issue is the hesitancy to have the vaccine. And really, I think that's more down to the way we have put the vaccination across to Kenyans as a whole. It would seem that people are very reluctant to take this route. However, I must say in the last few months, things have changed slightly to the fact that people are more concerned with what is happening, certainly within our area. We're in the Mukieni County and have begun to see visually people getting sick and losses of lives in the community. So this has led to some concern with the people, obviously. And that has brought some people to come forward looking for vaccinations. To go on with that, we are very much doing our best in what I think is a difficult scenario, but we have tried to engage through KEPSA and their initiative, and we are hoping to be able to solve the supply issue in the near future. But that still will bring us to the problem of the hesitancy of the vaccine, obviously.
Thank you, Mr. Miller. I want now to bring in Mr. Wasike, who is the Vice Chairman, Kenya Hotel and Keepers Association, and we know how the hotel and tourism industry was impacted upon. And even when the Executive Director of the Federation was making her statement, she indicated that the service sector needs to be really a priority. And now, Mr. Wasike, please, can you share with us your experience on the impact of COVID-19, what it has had on your business in the sector, and what you're doing to ensure that the staff are vaccinated and the challenges that you're facing? Thank you. Mr. Wasike, over to you.
Yeah. Thank you very much, and thank you for having me on this panel today. I think all of us know that if there is any industry which has really been hit by COVID-19 is the tourism hospitality industry. Last year we had to close between the months of May, April, I think, and June for total closure because there's absolutely no business. When we opened, it was mandatory that all of us had to go COVID tests before we can be able to open, and we are given very stringent measures that we are supposed to apply so that we can be able to reopen. And then this year again, we had to close for a few months because of the same challenges. So our industry has been hurt. Many members of our staff have lost employment opportunities. Business itself has really gone low. The arrivals internationally have reduced. Right now, we are dominantly depending on the business, which is purely national and in some cases regional. So we have been hit very hard. And so we support anything that can be done to bring the economy back to normalcy. And for us, it was very good when we were considered as frontliners when the vaccination began. And we have had a very good response from our members of staff. As we speak, I think easily more than 90% of the people who are in our business have already been vaccinated. It is true some of them have had the vaccination hesitancy, which mostly has come because of either religious reasons or because somebody is a lactating mother or somebody is an expectant mother. And as the CS said, more and more truths are coming out and we are being able to deal with this issue slowly, discussing with the people, and many of them are now being able to get their vaccinations. We also know that there's a bit of cherry picking of vaccines, with many people saying they would like to get their vaccination being the J&J because it's only one dose as opposed to the two, which is applicable for both Moderna, Astra, and the others. But having said that, almost all members of our staff are now vaccinated because we are committed in ensuring that we have a safe working place. What frustrates us a lot is what was said by Madam Mugo, is here we are working very hard to ensure that we are creating a safe environment for people to come and enjoy the hotels. But when you look outside in the political field, when you look outside in the marketplace, we see people who have thrown all caution out of the window. We see masses where there's no social distancing, there's no masking. And so we almost wonder, why are we working so hard to control this item here? And outside, we are working so hard to destroy what we are building. So that is our current frustration in the marketplace. The other most important thing for us is to see as many Kenyans as possible vaccinated, because as soon as they are, it will be easier for them to be able to move and come to the facilities. Also, we are saying, instead of having these global bans which keep coming, why don't we have targeted bans? And I think the CAS alluded to this as it is being done in other places. So for example, instead of saying that you cannot travel at night, why don't we say the people who have already been vaccinated are allowed to travel? Or the people who have taken these measures are allowed to travel, as opposed to closing the whole economy and then taking all of us down to our feet. So those would be my initial observations. Thank you very much.
Thank you. Thank you, Mr. Wasike. I think that is really, really important. And as you've rightly said, the sector was really hit hard when the COVID-19 pandemic broke out in the country. And you have done all you can to support the sector and to comply with the protocols, and even for the vaccination. It's so encouraging to know that almost more than 90% of the operators or the staff have already been vaccinated, and it speaks to it proves a certain point, even that the chief administrative secretary, I think, as I come back to you, you need to see that the workplace is an opportunity for vaccination. It provides an opportunity when you engage the employers, when you work with them, then you can be able to reach out to a wider population of the workers and even their dependents. And so with that, I would want you to speak on two things that have come up. There is the hesitancy in getting vaccinated, and from where we sit, we understand that is to do with a lot of the myths that are around the vaccination. Perhaps if you can just address to the employers, the more than almost 300 employers that are logged in about those myths. And also, as you address that, if you can at least comment on whether there is a consideration to have a dedicated program or vaccination program for the workplaces where you're working with the employers, and it is known now that with FKE and with the employers, you roll out a program that is dedicated for the workplace. Because as you rightly say, just as the government needs to be fully operational, we need the businesses to be fully operational so that then the economy can be able to move. So I don't know, Madam Chief Administrative Secretary, if you can speak to that.
Thank you, thank you. I'm really enjoying the discussion we're having today, and also I'm going through the Q&A and the chat sessions, and there's many questions that are coming up. I think on the issue of vaccine hesitancy, this is, a problem that we've studied and engaged WHO and all our partners across the world to try and understand its genesis, the factors attributable to it, and then of course how we can mitigate it. It's interesting to note that the problem continues in different parts of the country. For example, Japan, as a country that has done fairly well when it comes to testing and looking at COVID pandemic measures in terms of restrictions, are actually struggling when it comes to vaccine hesitancy. And if you follow through, you hear that there's a history of different vaccines that were administered in the past years ago that seem to have introduced misinformation in that population. When we look at our own country, we've done various CAP surveys to understand why are Kenyans not coming forward, which demographic particularly is not coming forward, what are the reasons, and how can we combat those reasons. And one of the things that we are getting is, one, there's heavy misinformation in terms of, and I've seen one person asking in the chat, there's word that, 2 years from now, people will suffer, different ailments or illnesses or death because of this vaccine. And this actually seems to be one of the rampant misinformation, pieces that are going around, along with chips inserted in the vaccines and a whole lot of other issues. What we've done as government, one, is we continue, to relay the safety of this vaccine. If you've noticed in our interactions, particularly in our briefings, we always invite partners, particularly WHO, UNICEF, who are recognized authorities the world over when it comes to ensuring the safety of vaccines and medicines and other technologies that we utilize. And by having them stand with us, by having them engage and interact with the community, the idea is to really allay fears when it comes to the safety of this vaccine. I think a key thing that we've done is to work with the Ministry of ICT. This has been happening in the background, where we've been able to do a lot of social media surveillance to see what are those ills that are coming up in terms of misinformation in our social media platforms. If you've noticed, we've partnered with teams such as Facebook, WhatsApp, Instagram. If you're active in those platforms, you'll notice that every time the word COVID appears in a post, there's actually a notice that comes at the bottom of the screen on COVID misinformation, and that tries to regulate that space to ensure that we are not spreading, a lot of false information. We are looking to see, particularly in our more informal spaces, how this can be combated. And what we understand by the nature of our population is that there are very strong influencers, such as the church, politicians, who actually shape community views. And so, as I mentioned earlier, one of our campaign strategies is to actually have the center of it being managed in terms of communication by the church, by our politicians, who are able to engage the public so well and of course then nudge positive behavior. And so very soon you'll see a lot of engagements in that light to try and drive down misinformation. I think another key powerful tool, in the past 2 weeks, we've been circulating data on our ICU admissions and mortalities, particularly in the private sector hospitals. If any of you have come across that data, you will see that for every 100 admissions, only one person was vaccinated. And most of the time that person had only received 1 dose. And of course, you have to appreciate our mortalities in terms of ICU. It's almost, there's a half and half chance that you walk out of an ICU when you get in because of COVID-19. The outcomes are not good. So again, we are using those platforms, particularly in the private sector, with private sector hospitals, to really drive for vaccine administration. A new strategy also that we are yet to roll out, that is sort of in the final phases of crossing the T's and dotting the I's, is what we are calling in-reaches. So for example, if you're a diabetic or you're a hypertensive or you have a kidney disease, asthma, or any condition that usually requires you to engage and interact with a healthcare provider or practitioner, what we're going to do is that when you come in for your clinic, when you come in for your review, the vaccine will be available for you on offer. So much like what we did during the HIV pandemic years ago, we actually introduced what we used to call provider-initiated testing, where if you come to me as a doctor, I will not wait for you to ask for the HIV test. I will actually offer it to you. And we've seen that that strategy actually can also reduce issues to do with stigma and hesitancy. And so we will be employing what we are calling Vaccine Enrich. And it's a program that we'll be starting very soon. It has not started, but we are working with our doctors and nurses so that vaccine is available for those chronic patients who require to interact with the system often. I think another thing, like you said, is just the opportunity that you have as employers. And I do appreciate, I keep seeing the question on whether private companies have the legal right to require employees to be vaccinated. And I am aware as government, we do know that there's litigation going on right now concerning the different directives that were released on civil service vaccination programs. But at the end of the day, like I said, different countries are actually employing incentive mechanisms to ensure that people are able to come forward and get vaccinated. Remember, as we talk about this vaccination program, our end target is to ensure at least 60% of us are vaccinated. If we should use the herd immunity threshold, 60 to 70% of us are vaccinated. And so what we can do right now as government, what you can do right now as an employer, is to ensure that this information is available, is to ensure information on safety concerns is available. I've seen a lot of questions on pregnant mothers, breastfeeding mothers. And like I said, right now as government policy, we have said the benefits outweigh the risks. So if you're a mother, you're with child, come forward, get vaccinated. If you're breastfeeding, there's no ill effect, you should come forward and get vaccinated. Remember, pregnancy is actually a condition that actually leads to reduced immunity by the very nature of what it is. And so when we look at what we're seeing in terms of data, and I've seen someone asking, do we have data on this? I'm happy to report we are doing trials. There are different studies that are underway, particularly with the Obstetrician Gynecology Society in Kenya, who are following mothers. Nairobi Hospital is also following mothers to see, if there should be any, untoward effects. But what we can tell you from the trials that have been done outside of the country, countries are vaccinating mothers who are pregnant and mothers who are breastfeeding. So right now, I can say that it's more riskier for you to not be vaccinated when you're pregnant or if you're breastfeeding. I think if just to be really clear on this issue of legal rights, right now, like I said, I'm sure you cannot force someone to be vaccinated if you're an employer. I'm sure, there'll be protections for the employee in terms of their rights when it comes to receiving vaccines. However, as an employer, you can put in place certain incentive measures in your institution to ensure that people are vaccinated. And of course, you can partner with the Ministry of Health to allay any safety concerns and fears. I think one of the things perhaps we can improve upon as a ministry is to share with you some of the data that we've collected on adverse effects. We actually have a huge database right now that is collecting any person who has reported any adverse effects, be it an acute one, be it a chronic one, be it a serious one, be it a moderate one. And I can tell you right now, as it stands in the country, nobody has passed on. We've had no mortality because of this COVID-19 vaccine. And right now it's 2.8 million doses administered. We have had people who have suffered the mild reactions, pain in the arm, a bit of dizziness, fever for 1, 2, 3 days. We've had a few people who've had moderate issues, but none of them have succumbed or have had any mortality, or any events that really hampers quality of life. And so we are happy with that. This includes even the issue of clots and whatnot. So nobody out of our 2.8 million administered doses. And so I think using that platform and sharing that information with Kenyans may help allay fears as well when it comes to the safety concerns of this vaccine. I think I've seen a lot of concern in terms of, the population covered as it stands right now. And we've always maintained the key challenge has been ensuring we have enough supplies Right now, we're in a good space. Like I said, by the end of this month, next month, we'll have about 9 million doses. So the issue of supply is no longer a challenge. What we need to deal with is to ensure that when these vaccines are available, that Kenyans come forward and get the vaccines. I have seen the question on, can we come in and come to your different workplaces? And my guidance on this is this: you can write formally. It has to be a formal process, either through FKE or as an individual employer. You write to the Ministry of Health, the Office of the Principal Secretary, and in your letter, you describe, your workforce, what they do, why you feel that would be necessary, particularly in high contact industrial spaces, where there's a lot of production, where you're dealing with food. Those are areas where we can consider and send a team, and particularly if you have a large number of employees who need the vaccine. And it's important to understand, FKE members, is that the logistics of running this exercise prevent us from coming to your factory if you only have 20 people. Sorry to say that, but if you only have 10 people, we need to mobilize cold storage equipment and a vaccination team and a health information change system team. So what we are encouraging is if people can group together and band together, that makes it easier for us in terms of efficiencies, as opposed to coming to just deal with 20 people or just 100 people. If you give us 1,000 people, then that's a good stock of people to come in and deploy teams to be able to run a vaccination outreach in your center. Of course, that means that there's a responsibility as FKE, as an employer, for you to be able to mobilize people, for you to be able to have shared some pre-information on safety concerns and all that. And all that can be arranged. We can always prepare for you information packs that you can circulate through your HR offices, and then mobilize people to come forward. The issue of cherry picking is an issue which we essentially have worked in a framework in the ministry to be able to avoid cherry picking. We do have certain facilities that have been designated to offer certain vaccines. I've seen a lot of people requesting for those lists. Those lists are updated in the Ministry of Health website. However, there's a caveat. When we got in the Moderna vaccines, we've seen almost a diversion of people to certain facilities that offer that vaccine compared to others. And so what we're doing is and as policy, what we're saying is that you will receive the vaccine that is available in the facility that you go to. I hope that is clear. As opposed to government coming forward to tell you J&J is available in Mercy Clinic, Moderna is available in Mugo Clinic, that will create certain incentives that will just lead to shuttling of people. So what we're doing is that we will provide a list of where the vaccination is happening, which posts are offering vaccination. And when you get there, you will receive the vaccine that is available. Now, I've seen in the private sector, I've seen different hospitals already advertising. If you go to the different hospitals, particularly in Nairobi, they have already put in place what vaccine they have available in those hospitals. You can always access that information there. But we really are disincentivizing the idea that, okay, Moderna is available in Kirinyaga level 4, so everyone runs there. Because then that will just lead to, one, potential expiries of other doses, and then of course, excessive workloads for those facilities. I've seen a question on, are we happy with our targets? Of course, 8% is low, but we are working to improve on that and to ensure that now with our 9 million doses, December could possibly be a month where we de-escalate some of these measures, particularly if we can reach our targets. There's a lot of questions on, I'm just trying to look through this very quickly because of time, but I can see a lot of questions on communication. Are we using our radio stations? Are we using the different local radio media? And yes, indeed, those are strategies that we're employing. If you listen in, you'll notice within the ministry, we actually have experts in the different vernaculars who are going around and engaging the community in the different radio stations. I think if I haven't answered anything else, I think I'll type it out in the Q&A section. Over to you.
Yes, thank you, Kaz. And I think you've touched on many things that we had asked, and we'll have an open session in Q&A, which will come up shortly after some few questions that we're dealing with. I think You touched on a very important question, which was about the mandatory vaccination, and if that is being considered at some point. Perhaps you've already indicated the trends that you're seeing across the world, and perhaps in the policy sphere, Kenya might be also headed in the same way. Can I just speak the thinking of the executive director on that, and then also the other two panelists, Wasike and Sean, from their workplaces on that?
On mandatory vaccination?
Yes, mandatory vaccination.
Well, this is the elephant in the room, isn't it? Is there a case for mandatory vaccination? And I think Dr. Mwangangi has addressed it very candidly and has been quite clear, and I do agree from a legal perspective that we don't have a law that would allow an employer to demand that an employee must get vaccinated. That we can't control. What we can control is what happens in workplaces, because the employer has a right to manage the workplace. And as we said earlier, it is the employer's duty to ensure that their workers work under safe, healthy conditions, the welfare of the employees. So the employer is under obligation, has the right to manage the workplace and to create policies, procedures, conditions of work. So an employee who chooses, maybe is a better word, not to be vaccinated for some reason or another, cannot demand that they must report to work. So I think that is the catch-22, because there are constitutional, fundamental human rights and freedoms, freedom of choice, freedom of conscience, and you have to balance that against the rights of the rest of the population, the rest of the workers, the right to health, the right to a safe and healthy work environment, the common good, which I think we've talked about. So it's not just a question of the law and whether the employer has a right, which we don't, in terms of demanding that you get vaccinated, but we can control what happens to the workplace. So even the case that is in court, which we're not discussing, really will have to determine this issue. The rights that are in the Constitution, the right of choice, the right to health, also have a rider, because there is a section that actually allows the court to determine whether an individual right and the right to choice supersedes the common good, which obviously does not. And that is a challenge we have as a country. So I like what Dr. Mwangangi has said about incentivizing the workers, making a case for vaccination and giving data, because a lot of people are asking, are there statistics which we can use to assure us that, to put it in colloquial language, nothing bad will happen to you. There'll be no adverse effects on you as a woman, as a man, if you get vaccinated. I'm very happy that Dr. Arya said there's actually no data to support the fear that there are adverse effects from the vaccines, which is the main thing that Kenyans are afraid of because of all the myths and the misconceptions. So the employers have a role to ensure safe workplaces and to require employees who would be a danger to others, maybe to work from home if they can. That should be the challenge. If your work cannot be done from home and the rest of the workers, the colleagues have been vaccinated and you choose not to, then of course you're endangering the rest and it may be difficult to allow you to come to work. And that is where now that individual choice that an employee makes would also affect their right to work. And I don't think any reasonable person would argue that an employer who demands that employees who are vaccinated and are therefore safe to come to work are the ones who should come to work. So the need to balance these rights and freedoms and subject them to the greater good of all mankind, all colleagues, is the prevalent issue. Legally, we can say we have no right, but there's social issues, there are health issues, there are scientific issues, which Dr. Mwangangi has told us gives us no justification for those fears. So I think the answer lies in what Carl said earlier, which is education. We must invest in education, in addressing the people's fears and the reasons behind their hesitation, so that people are informed and can see the benefits of vaccination as opposed to any of the other fears that one may have, so that we can make it a personal choice, a happy voluntary choice for you to get vaccinated because of your own good and because you don't want to endanger your loved ones, your colleagues, the people you interact with in supermarkets, in churches, and it therefore behooves you as a responsible citizen to undergo vaccination. So as employers, we're saying we can put in place policies, we can put in place procedures to be followed, and as the vaccine becomes available, because that was the issue, and this is my last point, we couldn't say employees should get vaccinated, push for it when there was no vaccine available. But now increasingly we have 9 million target in a short while. Currently, we have more vaccines than people. So as long as the vaccine is available, then we can require employees to get vaccinated for the common good.
Thank you, Executive Director, and that's very really important point. Looking at it from also that as an employer, you have a responsibility to ensure the safety of the workplace and the safety of all the staff, and so then you are trying to juggle between the individual right and also your responsibility as the employer, and also the highlighting about how we need to work together and be able to provide the right information to the workers, educate them and the whole population so that they can be an uptake of vaccine. Now, if I can hear just a comment from the two other panelists, Mr. Miller, on the same, perhaps in just 1 minute, and then also Mr. Wasike on the same. Mr. Miller.
Yes, obviously we are unable to make it mandatory, but we are trying to sort of provide awareness by giving out data and information packs. I guess, sort of some education behind why people should have vaccines. Because obviously we must follow some protocols. As you've said, if we're to have somebody come into a workplace without a vaccination and others are at risk because of that, that is an issue for certainly places like ourselves who are highly dependent on labor. So it is difficult, but we are trying to show that it's the right way to go. And now that our supply issues are no longer a problem, we are now trying to push sort of the educational side. I think we were slightly concerned in the beginning when you can't educate if you can't give, but now we can give. We want to show that it's safe to have the vaccine.
Same question, comment on the mandatory vaccination at workplace and from your experience in your area, your sector.
On our side, what we find is that when people are engaged and they explain to, there is always a buy-in. So we find that even the people who are very much against vaccination, when you call a person and you tell him, listen, in the event you become sick today, does it occur to you that there's perhaps no hospital bed that you will be able to get? Does it occur to you that maybe the deposit that you have to put in the hospital is 600,000 shillings, and maybe there's no medical insurance that will cover you? And so we're finding that as we explain to the people and as we talk to them, the buy-in is actually quite good. And for us in the hospitality world and in tourism, you realize though the government was vaccinating people who are 58 and above, when the window was open for us, we even got our people who are younger than that getting their vaccination. We also sold the idea that we want to create a safe working environment. You'll remember that by nature, hotels are really very clean places and the state of hygiene and cleanliness is very high. So with the COVID, it was just additional and enhancement to make it even better. So there has been a buy-in, and as I said earlier, right now we could easily be saying that amongst the hotels, particularly in Mombasa, I think also in Rift Valley, even in Nairobi, the vaccination could be as high as 97%. So we believe that if every other employer will sell the idea, as opposed to forcing anybody, just explain to them what it means, the buy-in would certainly be there. That's our experience. Thank you very much.
Thank you, Mr. Wasike. And just as before we go to the open session, I have two questions. One for the Chief Administrative Secretary, and the other one will go to the Executive Director of the Federation of Kenya Employers. And to the Chief Administrative Secretary, looking at the trends that we have, and you've seen what is happening, on the vaccination program, in the containment measure, we've seen the political situation and the concerns that even the employers have expressed here. And we all have this one need, that we need the economy to be fully operational. We need to resume the business as operations as normal as we can. From all indication, when are you seeing us resuming the operations to a normal level, the business operations as a country?
Thank you for that question. Maybe to just explain to the employers, there's usually a process that we undertake to review the COVID situation, particularly before we brief the president, and decisions are then made in terms of the measures. And the idea is, one, we always have our modeling team. And I've seen a question talking about how do we know that we're in the fourth wave or the third wave, what informs that? We actually have a consortium in the Ministry of Health that consists of all the academic institutions in the country who do disease modeling. And that is University of Nairobi, JKUAT, KEMRI Wellcome Trust, amongst others, who come together and review all the data that we have, and who then put in place mathematical models along with the data that we provide to determine where we are as a country in terms of COVID-19. And so usually there's a review process with the consortium team, and then a determination of any adversities in the hospitals and in the system, in the health sector system when it comes to COVID-19. Now, what we are foreseeing is that if we can get these doses into the arms of Kenyans, this 9 million or so doses that we should have by that time in December, then, of course, coupled with that and looking at the model, the mathematical model, remember, if you know about Markov models, it's a model that's inputted using some systems. We will then be able to determine whether it is a time to de-escalate or to maintain. But what we are seeing that countries have done, particularly abroad, if you saw the UK, there's a time they de-escalated their measures. And then, of course, we had new variants coming up in. So it's a very fluid sort of situation. It's not a hard and fast, but I can tell you the will of the government is actually to relax these measures and to ensure we get back into normal business, at least in terms of the hours for business. And so, yes, there is hope for December. I cannot, stand with authority and say that there'll be an opening or a closure, but I can tell you that using our mathematical model together with inputting of 9 million doses in the arms of Kenyans, we should then be able to see how December will look like. But all intents and purposes by government are to ensure that these measures are de-escalated and that we have many Kenyans vaccinated by that time.
Thank you, Dr. And I think that gives hope to the employers to see that there is that willingness among the government policy decision makers on the de-escalation of the measures and ensuring that businesses get back to normal as it can be. And we are hoping and trusting that as our efforts we are putting in to ensure that the workplaces are safe and the business, the same thing will be then done to the political situation, so that then whatever we are doing is not eroded by the political happenings. And now to the Executive Director of the Federation of Kenya Employers, there is a lot that the Chief Administrative Secretary has highlighted, and you've seen of what can happen. What do you consider as the role of now employers and FKE in helping the country to deal with the pandemic?
Thank you, Stephen. First, I'm really grateful to Dr. Mwangangi for recognizing the role of employers in fighting this pandemic. and specifically in enhancing the uptake on vaccination. And we will continue and want to work even more closely with the government, specifically the Ministry of Health, to use the workplace as a vaccination point. And I'm really glad that she has told us that we just need to write to make a case for on-site vaccination, and that we can bring together several employers in one location so that we have the numbers. And that is something we can do, and we're grateful for that. The second one is sharing information, because what we've been talking about is the place of awareness raising, information, and removing the myths from vaccination from employees, from Kenyans, so that they can make voluntary choices to be vaccinated. And they offer that MOH can share with us information packs, which will help us. So we want to work more with the ministry to be able to do this, because as you know, workplaces are very ready and important avenues for enhancing the uptake on vaccination so that we can reach the 10 million target, which the government has set, and hopefully exceed it. At the Federation of Kenya Employers level, from the beginning, when the head of state asked us to allow employees to work from home, we sent out communication. We participated and partnered with DOSH to come up with guidelines on this, and we will continue to do that so that we can enhance health and safety measures, and also employee wellness and supporting employees in addressing psychosocial issues. The pandemic has put a lot of people under strain and stress. We'll continue to do that. We have OSH, Occupational Health and Safety Committees, which are also important partners in this fight, and we'll continue to work with them and educate them to do that. One of the key issues, which I think it's Mr. Wasike who talked about it, the medical cover for COVID is a big issue. It's not currently covered. Some insurance companies have opened up to cover it. Just like we had a problem with HIV at the beginning, it was not covered, but now I think it is covered. We'd like to see COVID treated as just one of the illnesses. We'll engage on that to see if that can happen. And finally, really just promoting the uptake, creating that awareness, promoting the uptake, because this is the only way we can reach the herd immunity. It's 60 to 70%, and we can then begin to open up. If we can do that by December, it will be our joy to make it possible for business to open up and be able, therefore, to drive the economy to address all the issues that the country is going through. So those are some of the key things that FK will be doing together with our members, who you can see are very engaged and very willing to play their role. Thank you, Stephen.
Thank you, Executive Director. And I think this brings us to the end of the first session. We've had really interesting discussion. We want to go to the open discussion where we are looking at the various questions that have been brought up. And I think all of us are then happy looking at the discussion that has been there. I know the Chief Administrative Secretary and the Executive Director, looking at the statements you've made, it provides comfort on both ends, and more wanting us to work together. I want to hand over to my colleague, Grace Kaome, who is going to take us through the open discussion session. Grace, over to you. Thank you.
Thank you very much, Stephen, and thank you, panelists, for the very informative conversation that you have had this morning. So at this point, I'd like to look at the questions that have been posed by the various participants in this session. And what I will do is try to group them as much as possible, because quite a number of them are related. So we will start off with the CS Mwangangi, and I'll first package the questions around the safety of the vaccines, the processes that the government has ensured have been taken care of in terms of checking on the safety of vaccines that are coming into the country that we are admitting. I've seen quite a number of questions on FDA approvals, and some of them that may not necessarily have received FDA approvals. What is the government doing about that? And is the government assuring people that the vaccines that they are receiving are safe? And then there was a specific question around AstraZeneca, and especially regarding travel, and the fact that some In Europe, it's not received full recognition, and so it's posing challenges for those who are traveling. So CS Mwangangi, kindly, if you can address those questions. Over to you.
Thank you, Grace. Yes, so when it comes to safety of the vaccines, I think it's important for people to understand that there's actually a process, a scientific process that we usually undertake to ensure safety of vaccines, but not just vaccines, the medicines that we use, the drugs that we use, and also technologies that we use, such as wheelchairs, orthopedic implants. They all go through a process, and usually it's a 4-step process. And the 4-step process includes trials at different levels. So there's the first trial, second trial, third trial, fourth trial. And the idea is that the very base of a trial is what we call safety measures. So when you're looking at a product, be it a drug, be it a vaccine, and you're trying to ensure that it's developed for production, the very first step that takes place is usually a trial on safety. And this takes place in different specimens under different experimental conditions to ensure that that commodity or agent is safe. And this took place for all vaccines that are currently in Kenya. And it's important to note that these safety trials take place, should I say, under different jurisdictions with different participation of different members. And usually the vaccine or the drug will move into then the second phase and the third phase. And the idea is that with every incremental phase, you're increasing the population that you're studying. So that you're saying that this vaccine was safe in 1 into 10 people, and it was also safe when you look at 100,000 people, it was also safe when you look at 1 million people. And so right now, when we look at the safety of all these vaccines across the world, I was trying to see some figures the other day, and the world has close to vaccinated, I think almost 20% of the adult population. So those are hundreds of millions of doses that have gone into people across the world. And so in terms of safety, internally as a country, we have the Pharmacy and Poisons Board that actually executes different checks and balances to ensure safety of the commodities that come into the country. And again, all the 3 vaccines, soon to be 4 by the end of September in the country, have undergone those checks and balances externally outside of Kenya and internally within Kenya. And when we look at the issue of safety, and I don't want to belabor this point, it is such an intricate, complex, and should I say more or less even an industry in the world when it comes to safety of medicines and vaccines. We have different authorities that offer, safety checks across the world. I think you've all heard of us talking about WHO, which is an organization that is able to do the safety checks, but also within Europe, and this brings in the issue of Covishield that has been asked on the Indian, AstraZeneca vaccine. There's different jurisdictions in Europe, in America, in all the different continents, Canada, where we have institutions that ensure the safety of different vaccines. Now, the vaccines that are being administered in the country, AstraZeneca from India, that's Covishield, Moderna, Pfizer, which is coming by the end of September, and J&J, have all undergone what we call emergency use authorization. And like I said, perhaps we have failed as a Ministry of Health to be able to articulate these issues in a simple manner where people can understand what processes are undertaken. As I sit here today, this morning, I just had a meeting, and this is an EUA for Sinopharm. This is a vaccine that's coming into the country. And it's a process. I'm looking at the checks and balances that were conducted internally. And if I can read it to you, I'm seeing almost close to 15 studies conducted in Romania, Mongolia, Serbia, Morocco. So we review, it's usually a huge contingent of documentation that is reviewed by experts to determine the safety. And so those processes have been done. Now, when you talk about FDA approval, the FDA is a similar organization like our PPB here in Kenya, like the European agency, like the Australian and the Canadian agency. And the FDA most recently indicated that they will grant Pfizer full FDA approval. Now, for people to understand, it's now probably 21 months into the pandemic. The Pfizer vaccine is the only vaccine that has been considered right now for full FDA approval. However, prior to that, 1 million plus hundreds of millions of doses of Pfizer have been administered under emergency use authorization, which is what the rest of the world is doing. So when I see questions on FDA approval, I've seen one on why have we allowed J&J in the country. J&J has actually undergone the same processes that I've described to you across the world, particularly in Europe and in under the WHO jurisdiction, and has been determined to be safe. One thing we need to understand as Kenyans, like I said, this is an industry. There's a lot of politics when it comes to vaccine approvals. Issues that I may not speak of right now that determine some of the market forces when it comes to approvals of these vaccines. So what you see in the media, particularly when you see FDA approvals, and full approvals also have certain connotations when it comes to the economics of vaccines across the world and the markets for vaccines. But I can tell you what we have in the country is safe. I've seen a question, someone has sent me a question on my direct line on, somebody somewhere passed on 2-3 days after receiving the vaccine. It's important to note, one, through our pharmacovigilance system, we're able to pick any adverse effects that have happened, but more importantly, investigations to determine whether that death was caused by a vaccine. And like I've told you, particularly if you remember when we had the issue of clots early on last year, these issues were investigated and it was determined whatever mechanism would be possible for that to happen, and also who would be at risk in terms of that happening. And so right now we still stand by saying that the vaccines are safe. Remember, you can take a Panadol today and pass on 2 hours later. Your death might not be attributable to that Panadol, or it could be. And so there's certain investigative processes that need to take place for us to be able to determine the cause of death. Now, on Covishield, what we've done as a continent through the African Union is that we've approached the European Union and the agency there that grants approvals for them to be able to actually register Covishield as a vaccine that's recognized. And good steps have been taken there. Applications have been submitted by the Indian company to the European agency to ensure that this will actually be accredited. And when we ask for information on this issue, what we are told is that it was just a matter of delays in applying for that accreditation process, not that Covishield is inferior in any way when you compare to the AstraZeneca that's being issued in Europe. And so that's a process that's being dealt with right now. Once it's concluded, we'll be able to share the information, and it's being handled at the African Union level as opposed to a country level, because there are many countries in Africa who received Covishield. I hope I've been able to touch on those questions, Grace.
Sure, you have. Thank you very much, CAS. So I've seen quite a number of questions coming through on issues of awareness, doing it in Kiswahili, how we do it for the rural areas. I think that's something that the ministry can prioritize. And so that's a question I would like to pose to Sean. Being an employer who has people working in those areas, what exactly are you doing to encourage people who probably may not necessarily be techie savvy, may not necessarily be able to understand the communication in English and those adverts that are going around? What are you doing on the ground to encourage uptake of vaccines in your workplace and to create awareness of your employees at that ground level, mashinani, so to speak? Sean?
Yes, we set up a COVID committee with various people from various departments, and we've really tried to use them to create awareness to the people. We do also try and send out leaflets in particularly mainly in Swahili. English is not really, is a lot of people know English today, but yeah, most of them are going out in Swahili. But it's mainly the COVID committee that we have on site that seems to work the best way. There's also group leaders that we try and involve, local chiefs, especially on the surrounding community where we are seeing possibly more problems with COVID than actually on the estate. So news travels fast. Although we are big, you hear people with issues, and we try to use them to sort of spread the word of why we should be vaccinated.
Thank you very much. So in the interest of time, at this point, I'd possibly give a chance to Wasike to give his final remarks, and then we can take around from the other panelists. Wasike, kindly.
Yeah, thank you very much, Grace. I think, as I said earlier, if there is anybody who's suffered from the situation that we are in today, it's the hotel industry and the tourism industry. And that is why when the opportunity came for people to be vaccinated, we went for it. We understood science and we went for it. And we've been able to ensure that most of our staff are vaccinated. In fact, we have gone further. Some of the people who work with us are working with KEPSA to be able to ensure that it's not only the employees who are vaccinated, but their families. So we're dealing with KEPSA and their efforts to ensure that our wives and our children and anybody else who is related to us is also vaccinated, because we are all related. So for me, the big issue is, if we are all vaccinated until almost 95, 96%, we want to see the economy open. We want to see more vaccine coming in so that more and more people are vaccinated, because we cannot continue being where we are, with people being jobless, with people being on half salary and so on and so forth. So we just want the vaccines which have come to be rolled out very fast. There are many people who are willing. People are talking about vaccine hesitancy, but to be honest with you, it doesn't bother me. I think when we have a lot of vaccinations, people will take them. And once many people take them, we shall reach the so-called herd immunity. And then the economy can come back to play. Those really are my comments. Thank you very much.
Great, thank you, Wasike. They are indicating that really you believe that vaccines are the way for us to get back our economy up and running. Any final remarks, Sean?
No, thank you. Thanks very much.
Great, thank you very much. So we can now go to CS Mongangi before we go take it back to our Executive Director who will close for us. Any final remarks, CS?
Thank you. No final remarks, except I've seen a question on booster doses. Right now, as government policy, we are not offering the third booster dose until we have a good proportion of Kenyans vaccinated, because once we open up for third doses, it means that someone is missing their first dose. And so that's what the current policy position is right now. However, by next year, when we have more and more doses, remember we have procured 13 million doses from J&J, we may then perhaps introduce that. I've seen a question on mixing of doses. Again, the jury is still out on that. We've received about 5-6 studies that have mixed different platforms together. Theoretically speaking, and I should not be quoted for this, but theoretically speaking, immunologists have told us that mixing actually provides a stronger immune response. However, no study, and this is important, no study, particularly no large-scale study, has been done to that effect. Thank you, and over to you.
Great, thank you very much. So at this point, I'll hand over to our CEO, Mrs. Jacqueline Mugo, who will wrap up the session and close it for us. Karibu, CEO.
Thank you very much, Grace. You've done an excellent job in trying to deal with very many questions. I know there are members who may have posted questions which we haven't handled here, but we will answer you online. And that we can promise. Thank you so much for your active engagement as members. Mine is really just to thank our panelists very much for their time and for their informed input. We are eternally grateful to you, CAS Mwangangi, for your not just sparing time, but really answering a lot of our questions, sharing with us the current information, offering to partner with employers, and generally just being a very open and accessible person. We appreciate that very much. Don't be surprised if we invite you to come back again, because employers have a lot of questions. But what I want to assure you, CAS, is that we are your partners. We are willing to support you and to work with government. If you need anything from employers, do let us know, and we will take you up on your offer. We thank you very much for the excellent work you and the team at the MOH are doing on behalf of all of us. And may the Lord help you and strengthen you in that effort. Thank you, Sean Miller and Mr. Wasike for coming in as members and giving us what you're doing on the ground and your industry perspective. Thank you for the work that you're doing. also to help us combat COVID-19. We will continue working with you. Finally, let me thank all of you members. We have very many members, almost 300, who are logged in, because this is a very important topic. It's a very hot topic. It's a problematic topic. Employers are very keen to do the right thing and to ensure that the employees are vaccinated. So thank you for logging in, and we'll see you at the next webinar. Thank you very much also to the FKA staff and for everyone. Kwaheri ya kuonana, asanteni sana, and have a wonderful day.
Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasema asante waajiriwa, asante wanachama, asante washirika, asante. Tunasema asante waajiriwa, asante wanachama, asante washirika, asante. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasema asante waajiriwa, asante wanachama, asante washirika, asante. Tunasema asante waajiriwa, asante wanachama, asante washirika, asante. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasherehekea uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasema asante waajiriwa, asante wanachama, asante washirika, asante. Tunasema asante waajiriwa, asante wanachama, asante washirika, asante. uhusiano wetu, mashirikisho yetu, sauti ya waajiri wetu. Tunasema